I would now like to welcome to the stage Sabrina Ladha, Julie Wildgoose, and Taharka Gibb.
Good afternoon, everyone. First, I want to thank the hosts, Greater Purpose Conference, for an amazing opportunity to have conversations about such important topics. Before we dive in, I have an invitation for all of you. I ask that you, for a minute, put your devices down, put your feet on the ground, close your eyes, and take a deep breath. Deep breath in, deep breath out. And then I want you to think about you being a younger person. And then I want you to think about young people in your life. With your eyes closed, really grounded, how many of you personally know a person or a young person who is struggling or has struggled with their mental health? Just raise your hands. I invite you to open your eyes and look around. That's nearly every single person. And that's a challenge. That's why we're here. Across Canada, we know young people are navigating a mental health crisis. 1 in 2 people report feeling anxious or depressed. Suicide remains the second leading cause of death among younger people, and in some regions, the average wait time to access counseling is more than 6 months for a generation that needs support now. So before I get started about the topic and introduce my amazing colleagues here, I wanted to start with introducing myself. My name is Sabrina Ladha. I'm the VP of Green Shield Cares. I represent Green Shield, which is Canada's only national nonprofit. Without shareholders, we can ensure that 15 to 20% of our earnings are given back to community, with a commitment of $75 million by the end of 2025. And with a few months left to go, we are well on track to exceed that and impact over 1 million lives. And one of the new things we're really going to be focusing on is an initiative called the Youth Mental Health Initiative. Not fully publicly launched, but for many years we've been talking about this topic. So we focus on mental health, essential medicines, and chronic disease management. And within mental health, we've been seeing youth mental health as a challenge that no one organization is going to be able to solve alone. So as we've been thinking about it, as a funder, as a mental health, a healthcare organization with 5,000 therapists and other commercialized services, we've been thinking about how do we participate in the problem? How do we actually fund organizations? How do we think about who the partners are? How do we actually make mental health services more accessible, equitable, and personalized? And we've actually spent the last 2 years just listening and learning and funding. And so what today will be is these questions that we've been asking ourselves. Who's falling through the cracks? Why are systems still so hard to navigate? And how can we work alongside younger people, not just for them, but to build with them something that actually works? We are collaborating with 25 plus incredible organizations, and one of those organizations represented today is jack.org. We deeply appreciate this partnership and are so excited to be able to have this conversation today. We've been mapping what works, we've been mapping what's missing, and where we can co-create the new reality from. But we still know there's a huge gap. Joining me today, there's Julie Wildgoose, who is the VP of Programs at Jack.org, a leader in youth mental health, who has spent her entire career shaping how we think about equity-deserving communities and how Canada responds to student needs. And today joining me is Taharka Gibb, who's the director of the Youth Mental Health Initiative on my team that has actively been talking to thousands of younger people across Canada and community organizations. I'll move over here to have that conversation. Okay, so we know that there's a gap. We're starting to talk about mental health. There's more data on mental health. But Julie, if we can start with you, can you tell me how are you identifying the greatest need and the emerging challenges today? And what is the data saying in terms of Jack.org and your previous experiences?
No, that's a great question. We get asked that quite a bit by people that come in and want to learn about our organization. What Jack.org is we are an organization that speaks to our youth at early intervention. We give them the tools so they can connect and talk to each other. We have programming that supports parents so that they can talk to their youth. And all of that is driven youth data. We have a huge network of young people that are telling us what's going on in their communities. We also look at research. We have a really extensive research department that has looked at the information that we're feeding back. Through our programming, we can reach out to over 120,000 youth directly and indirectly per year. And what we're seeing now is, of course, we have post-COVID information that came in, so we're seeing changes of how they're absorbing information and how they're communicating with one another. If you have any youth in your home, 25 and under, you know that the phone isn't too far away. And then we're looking at the climate, and we're not just talking weather patterns, but we're looking at economic climate, political climate, and of course natural disasters, and finding out information of what goes on in regions there. And StatsCan has actually just released some more information that we referred to. Before the conversation was really, let's talk about this early intervention in the grade school, early high school. And StatsCan just released some information that now tells us that that age group, even though mental health challenges start there, they're still feeling supported. And what it's also saying is that once they get out of that grade school, high school age, going into their early working years or their post-secondary education, that's when the supports fall off. And this is where we're seeing the increase of mental health crisis, suicides are going there. So our programming really gears towards that. And then we look at before coming to Jack.org, I worked for Inspire and oversaw their mental health outreach and wraparound supports. And it's the remote communities. BC right now is having a massive crisis with suicides. And we're just, talking to those communities. They're also reaching back to us. So it's a two-way reciprocal conversation that are going on, looking for supports to prevent crisis in their spaces. So we do a very big, I would say, coast to coast to coast scan of influences and what's going on. But our programming and what we are developing is really driven by what the youth from those areas are saying.
Thanks, Julie. Taharka, can you tell me, we've invested over $6 million in the last 2 years to listen and learn. What have we learned? And what are we seeing the gaps are from younger people, from community organizations? What do we need to focus on?
I really appreciate that question, Sabrina. Thank you. And as you've mentioned, over the last year, we've been really intentional engaging in a listening journey. There's 3 parts to that journey. One is understanding the data, as Julie mentioned. And so we've been working with Mental Health Research Canada to understand at a population level across Canada, what are the different barriers to access, to affordability, and care navigation for youth across the country. We've also been talking with mental health experts, such as Julie from Jack.org, such as the clinicians at CAMH, such as the wonderful practitioners at Kids Help Phone, to understand the ecosystem knowledge and where it is today. The last part that we've been doing is talking to the youth themselves. And that's probably one of the most fun and engaging parts, but it's engaging in conversation with youth to understand their perspective and why a certain support or a service may seem out of reach to them, or they just don't want to access it at all. A couple of key insights across this whole journey that have come about. The first one is that youth are definitely not a monolith, and it's a phrase, I didn't coin it, I'm just repeating it. It's a phrase I've heard before, but we've really lived and realized it in our programmatic work. In a conversation in a youth roundtable that we had a couple weeks ago, I asked the youth sitting at my table, what do you think about AI? Half of the youth at the table said that they thought that going to AI for therapy or mental health support was a great idea because it was accessible, because it was anonymous, because it was confidential. The other half of the youth at the table thought it was weird and they thought it was creepy. And what that showed me and showed our team in that instance is that we have to be flexible with what we're going out to the community with. We have to understand that not everything is going to address all the problems. There is no silver bullet to this, but it creates a lot of excitement for us because it means that we can bring lots of qualified professionals together who all specialize in different areas, all bring different capabilities, and we can address the problems that youth are facing today. So that's just one key insight that I'd love to bring.
That's an amazing insight, and we see this all the time. We work on women's mental health, and we've been working in women's mental health for a while, and when we work with Black Canadian women, they often say the services you provide are not enough. We want group therapy and we want peer-based therapy, and therefore we've gone out and found partners that can lead that, and now we fund that. So I offer that from a place of, even as we think about youth mental health, we've been thinking about who our partners are so that there isn't a one-size-fits-all, that every partner actually specifically speaks to and creates smaller communities and access and reach for the equity deserving communities and how they identify because they have intersectional identities. Maybe I can pass it back to you, Julie. Can you tell us about your work on campuses specifically and the campus assessment tool? Help us understand, what is the tool measure, what are you learning, and what are the insights?
Sure. It's actually quite fascinating. So Jack.org has chapters set up all across Canada. And that is where a group of young individuals gets together. They want to help advocate for mental health, youth mental health with themselves, with their peers. And they will get together, they'll ratify a group, and they're called a Jack chapter. We also have Jack champions, where we take the tools that Jack chapter uses, but they take them to groups that they already meet at, because we know it's hard for them to carve out additional time. So if they go into their clubs or their groups, their post-secondary, where they're meeting, and use a mental health mindset in that space so that they can be considerate of one another and recognize when others are struggling, not just in a very designated spot, it actually will spread. The awareness will spread organically as well. So both groups are offered what's called a community assessment tool, and it's very cool. It's your do your own adventure. So what they do is they have a series of questions that they identify, and they're looking at their gaps in healthcare and in mental health where they actually meet. So it could be their institute, it could be off campus, it could be the services that the institute offers. And every school and every club that finishes this community assessment tool will actually have a different outcome, because no two scenarios are exactly alike. And what they do with this community assessment tool is they can create policy on campus on how to make improvements to what's missing in the gaps. They can petition to have additional services available to them. They can create awareness events, or mini summits on campus, which we also further support, so that they can continue to grow the awareness and help each other organically. And it's just a really incredible opportunity. So they will work on this project, and then that data from their project is actually put into a repository with our JAC community folks at jac.org. And if another chapter or another champions wants to access that information on how to do a policy or how to create their summit or how to create their event, we actually can share with them the data that's been conducted at the other locations.
And so even within jac.org, there's an ethos of collaboration.
Yes. Oh, yes.
An ethos of how that works. Tarka, maybe I can pass it back to you. Can you tell us, what are we doing now? We have all these insights. Give us a sneak peek. And the reason we actually want to share today is we're looking for feedback. We're looking for partners. We're looking for feedback. Tell us what we should be doing and what we should be doing differently. Tarka, maybe you can start with where are we going?
Absolutely. So as Sabrina described, over the past couple of years, we've been on the listening journey. We understood in 2024 that Green Shield has a lot of capabilities around mental health services and around healthcare in general. We have a powerful digital platform, and we know that we can be digital first and offer services to individuals that may struggle in remote communities or may struggle with the bias and stigma of going in person to a provider. But what we didn't know is how can we mobilize those services, our funding and investment dollars, our community partnerships, to bring a holistic, comprehensive, and flexible service to meet youth where they are. And to ensure that it's also free and accessible as well for the marginalized youth who may struggle with affordability or access to those services. So what we're doing, what we're building, is a digital youth mental health ecosystem that connects Green Shield services with leading community partner supports and backs it with data and measurement so we can understand different care journeys and care pathways. And we're making sure that we open up accessibility and affordability so that those who may struggle with access to care can still get the care that they need and the care that they choose. This ecosystem is launching in a couple of weeks, and we're launching it in iterations and with feedback from community experts, from the youth themselves, and from various clinicians as well. What we're looking for today is for people to understand what we're doing and to understand that they can reach out to us, provide feedback and ideas and contributions, because we're learning and we're growing as we build, and we're launching with humility around understanding what youth want.
So part of the ecosystem is we are going to launch 25 plus community partners, and it's about scaling their services, making sure that people can find them, but also augmenting it with free mental health services with registered therapists, your subscription to ICBT, a virtual peer-to-peer community, and many of the capabilities that we have on the commercial side. We're going to unlock it and ensure that it's free for anybody that is looking for youth mental health services. We are early on this journey, but jac.org has been part of the journey. Actually, our first partner 2 years ago that was willing to take a chance with us to be part of our learning journey. Can you tell us more about this collaboration, but also how to collaborate in this space and why that's so important?
Actually, I think it's gotten better and better as time has gone on. Coming into it and learning about the relationship jac.org had initially and started with was really exciting for me. And then as the past year has developed, the collaboration piece is so important. We function, we're driven by input and output, and you creating that community of practice that we've talked about and I'm looking forward to, and introducing the other partners to us so that we have something to offer that's holistically solid to youth is so important to us. We're at the very beginnings, at the early intervention space. We talk to youth when they think that, and we don't deliver clinical care at all. We talk to youth through our different opportunities, our Jack Talks, where we train, it'll be almost 125 youth speakers to deliver over 400 talks a year across the country. But to have the, we talk about, yes, we can give you the awareness and we can give you the ability to see when there's see their problems, but the wayfinding piece that you are working on with yourselves and with your partners to get them the next level of help is imperative to the next step of us delivering programming. So when we can do that handoff in a safe space, in a safe way, the opportunity that you have for therapy. There's therapy pieces that don't cost our youth anything to access. That is very big too. We always want to advocate as parents and fix everything. If you're a parent or we talked about this too, if you have young people in your life and they're struggling, we're not qualified though. We're not experts. We're not doctors to do that. So if we have trusted partners that that can deliver care services and good referrals, and the autonomy for youth to be able to mitigate stigma and stand up and say, yes, I need help. That's the relationships we want to continue to build out with you. Being personally affected by mental health, and I was sharing this story with Sabrina. I lost my brother 3 years ago to suicide, and he had triplet boys. They're 9 years old. And when the opportunity came for me to come to jack.org, that's my little way of saying, yes, I'm going to help create programming for them. They just turned 13, and they are starting their own little chapter in 8th grade to practice so they can take it into high school to help other youth that are struggling with mental health. And I think that if these services existed 20 years ago when my brother was younger, that we may not have the same discussion about how I was affected, but the system that you are putting together and the partnerships that you are connecting are imperative for youth to get help and feel supported and have a place to go. So that's important to us.
And maybe last question to you, Taharka. If someone is interested in collaborating with us, what should they do?
Well, they should definitely reach out to me. So connect with me. We also have many Green Shield members here at the conference. As well, you can also just reach out to the team in general on LinkedIn. We're very open and casual and would love to have a conversation. Out of all the ideas that we source, we actually act on a lot of them. We listen to a lot of what people have told us, good or bad, criticisms, as well as positive feedback, and we listen and incorporate because we believe that it gets us closer to actually helping youth and putting something out into the ecosystem that is useful and is going to help alleviate this crisis in Canada right now.
And you listen, if I may add this, you do such an incredible job wanting to authentically know from the youth what they're thinking and what they are. You've done so many workshops with our youth through our jack.org network alone, and I know with your others. And that is a true invested partnership, and it makes a lot of sense.
Thank you, Sabrina and Taharka, Julie. We do have some questions from the audience before we head into our break. First question is, how does Green Shield's status as a nonprofit not only impact your funding model and the amount of funding that's available, but also the types of partnerships that you can shape? Does it make you more nimble? Does it make you different than, say, a typical for-profit corporation?
So I'm going to say yes. I'm in a very privileged position. I often say I'm very grateful for my job. I am mandated, being a nonprofit, being owned by a nonprofit and being the arm that represents the nonprofit, we are mandated to spend that money. We are incentivized to spend that money. We have OKRs at the board level, at the CEO level to ensure that we are not only partnering, but investing and really thinking about those three issues. So our money is mostly unrestricted. We can take the time to listen and learn. We can take the time to support, especially if you work in the mental health essential medicines or chronic disease space. We're really creative too, so please do reach out. And we have large dollars to spend as the company grows. Our budgets are anywhere, this year was 16 million, next year will go up, and it continues to keep going up. So there's a lot of appetite and desire to work on those 3 issue areas, especially for priority populations.
Our budget goes up and continues to go up, not something that you hear every day. Thank you for that. Despite working towards a shared mission, what challenges have emerged in your partnership, and what have you learned from them? This is perhaps for you, Julie.
I was waiting for Mark to answer. I was like, oh, tell me.
You go ahead.
There are no challenges in this
There
work.
is no challenge. No.
I'm sure.
Finding, usually like relationships, we have to have a common goal. So there's some things that we do that target different audiences and different things within our organization that are different than the mandate of what, you know, they're looking for. And we understand that. So being very open to communication and learning from each other what they're authentically want to do and where the space in which they want to sit is really the biggest thing. Like what is the best fit for both of us, if that makes sense. And that's really just listening to one another is the biggest thing. We have another program, which I talked about, the Be There certificate, which is a digital offering that we have. We take that learning fundamentals and work it into our chapters and our communities and our champions program. But on its own, it kind of sits on its own. So that's something a little bit different that I know that you can offer it out to your staff, but you don't get too much into that one at all. But it's fine. It works out. You just have to know what each other's looking for.
And maybe I'll add in, we start with pilots so that we can scale. The intention is to have multi-year relationships, not 1 year. And so we take the time to listen and learn. And that is honestly what's worked. Where it hasn't worked is exactly that, when a partner doesn't really understand what we're bringing to the table. We're not just a funder. We're not looking to just be the funder. We will do that in certain places. We do have a fund, a local giving fund aside for that, but we really want to solve some of these issues, and that's when the partner can see roles for each of the players around the table, that really works for us.
Great. Maybe we have time for one final question. Lack of a sense of agency is considered one of the major causes to youth mental health issues. What's your view on this, and is there anything that has been done or is being done to address this?
Oh yeah, no, that's such a great comment in itself. Work is actually being done by different organizations, right? There's a lot of us in a similar space. We're at the early intervention. There's more at clinical care. But the biggest barrier to that is really the awareness piece. Young people don't know they can advocate for themselves, and that's a challenge. So as we continue in the early intervention space to let them know and to give them that empowerment, it does transition and it slides through, you know, when they're coming out of 14, 15, 16. Young people don't know that at 14, 13 years old, they can actually ask for help on their own.
Yeah, and I'll just add a couple words to that, tying together a few threads from earlier in the conversation. Another insight is going to where youth are at, and something that Jack.org and Green Shield have a shared priority in is understanding the post-secondary landscape in the ecosystem. And what we've seen here is that relates really strongly to agency, because as we've listened to youth and their mental health challenges and the various struggles that they're going through, they may not feel comfortable going to their parents or going to the guardian or the people closest to them. So you have to come to them, and so many of them are going to school and post-secondary institutions. So if you can make them aware of programs and services and support, they can take control of their mental health in their own hands.
And avenues to access.
And what I will add is the reason we landed on building a care navigation system is we want to ensure choice. We've learned that younger people want choice. They don't want to be told what to do. So they get the platform to help them, show them the choices, and they get to select. And if they're not happy with the choices, they get 3 more. If they're not happy with that, they get 3 more. And so the intention is to bring them the resources, make it accessible, make it affordable, make it culturally appropriate, but ultimately have them decide.
Wonderful. Julie and Taharka, Sabrina, thank you so much. Really appreciate it. Okay, break time. And now is the time when the fun really starts to pick up before we head into our afternoon reception. First, expand your waistlines with our old friends, Do Good Donuts, a wonderful local social enterprise employing people with intellectual disabilities. If you've had Do Good Donuts in the past, you'll want to rush out and get them before they're gone. Don't worry, we have enough for everyone. Also, get your photo taken at our fun and inspiring AI photo booth. And last but not least, you will see further towards the elevator our immersive interactive group painting experience. We are going to reconvene at 3:15 sharp for our final 2 sessions of the day before we head into our wonderful afternoon reception. See you back at 3:15.